everybody. It's Ro, and we are here for Mommy Virtue, brought to you by MetroHealth. And today we are talking about breastfeeding challenges and solutions. And I have Abby with me, who's going to share her story. But before we get into that, a couple of facts. First of all, new mothers and families can deal with a various array of challenges when it comes to breastfeeding, including difficulties with milk production, latching, and pain. Breast milk is one of the only products that can provide all of the nutrients infants need throughout their first year of life. Despite this, only 24% of infants are exclusively breastfed 6 months, and only 55% of infants receive any amount of breast milk at just 6 months. In today's episode, Abby Myers is going to talk about your experience with breastfeeding and providing basically solutions for that. Now, can you share with us your role at MetroHealth?
Sure. My name's Abby Myers. I'm a certified nurse midwife and a family nurse practitioner. And we are a new group here as a group of midwives coming in. So I've been a midwife for almost 10 years this fall. I'm also a mom of 3, so I have some personal experience and my own breastfeeding journey, but it is something that I just love so much, and I love being able to help patients with this and guide
absolutely.
them.
So we talked off camera for a second. You did mention you have 3. I have 1. We both share a 7-year-old. Well, we don't share, but she has a 7-year-old as well as I do. And I breastfed as well. But can you share your breastfeeding experience with us?
Sure. So I was very fortunate. I was able to breastfeed all 3 of my children.
Okay.
My first baby, he came early. He was a little bit of an emergency at 35 weeks, and so that was not the birth I was expecting to have, and breastfeeding to me was a healing experience, and it went really well with him, getting over some obstacles and problems along the way. And then I went on to breastfeed my other 2 children as well with a great experience.
Now, would you say, just on a scale of 1 to 10, this is a personal question, what would you say was your love level of breastfeeding?
In those early days, it's a survival mode for sure. But overall, 10 out of 10, I loved my breastfeeding experience. Not to say that there weren't challenges along the way, going back to work and pumping and just establishing the latch in the beginning and feeling good about your milk supply. And luckily, I was very fortunate to have good support. But I just feel like, the more I can encourage and support women and help them along their journey, I feel like that's better for moms and babies and families.
Absolutely. So let's talk about the challenges. What are some of the challenges that moms face when it comes to breastfeeding?
Yeah, there are so many challenges. Initially, just kind of getting the hang of it. I like to tell my moms, both you and the baby, you're both learning, so be patient with it. It takes a while. Your milk does not come in for the first couple of days. Typically, moms stay in the hospital for 2 nights after they have a baby. Usually their milk doesn't come in until about 72 hours postpartum, so it's not until they're really home that they really get their full milk supply in. A lot of times babies struggle figuring out how to latch. They're learning the positioning. Some babies have tongue ties or things kind of getting in the way of that. And then another thing is, moms who have prolonged labors, if they had any complications during pregnancy, labor, or birth, some of those things can inhibit or kind of delay lactogenesis or the process of the milk coming in as well.
Gotcha.
So, yeah.
All right, so I know a lot of women will probably say, oh my gosh, I've heard horror stories about breastfeeding, and maybe that's why they've never attempted, or they did it, they can experience some of those horror stories, including pain. Is it ever normal to experience pain when you're breastfeeding?
Yes, I would say pain is not normal.
Okay.
Very normal and common to have discomfort initially or like soreness. And so what I like to tell my patients is that, think about this. If you weren't used to exercising and you start training for a marathon or start trying a new workout class, you're going to be sore, right? Your muscles are getting conditioned. They're getting accustomed to that. Same thing with breastfeeding. If you've never done it, or even if it's been a while since you've done it, it's going to take some time to kind of, for those things to get conditioned and feel normal, So I would say it's okay for there to be a little discomfort with the initial latch, but the pain should not last the duration of the feeding. If the pain's lasting the whole time the baby's breastfeeding or on the breast, that's abnormal. And definitely should be looked at by a lactation consultant or specialist where they can assess the latch of the baby and the positioning because we definitely want to prevent that. That's going to cause more problems down the road if the pain is lasting a long time like that.
Absolutely.
The soreness, can last for the first couple of weeks, and then typically after that, there shouldn't be any pain or soreness at all.
And that's while breastfeeding.
While
because of course
breastfeeding.
you know that there's if you were engorged.
Yes.
Yeah.
Yes.
So, which is a separate thing.
Yes,
but...
for sure. So a couple days after, once the milk comes in, there's, the breasts are engorged, they're swollen. It's very uncomfortable. Things are very tight and swollen. And that usually takes kind of the normal physiologic engorgement that just happens as a process. That can take 24 to 48 hours to resolve. Now, if that's happening later because maybe there's clogged ducts or mastitis is brewing, that is abnormal, and women should seek care at that point as well.
Okay. Okay. So I experienced this because when I gave birth at the hospital, you said that you usually see, I think you said it, or I just know that you get a lactation consultant that comes in. So what is that experience like for a mother? And then at what point should a mom even reach out for a lactation consultant? Maybe they left the hospital. Is there ever a situation where you don't get one?
No, definitely every woman, every mother should have one before they leave.
Okay.
Generally in the hospital, there are certified lactation consultants that go around and essentially round on all moms breastfeeding. Sometimes it can be tricky to be there right when they're feeding, maybe mom or baby's napping or in the shower, things. But definitely they should be seen in the hospital at least once. And I always tell my moms, whenever you go to breastfeed the baby, press your call light. Let them know, because even if things are going well, it's very, very helpful for a lactation consultant to come by, assess the latch. Even if it looks good, she can always give you pointers and tips that you can use once you get home. So every mom should feel good about that and have at least met with a lactation consultant at least once or twice while in the hospital.
Okay.
And then they should be set up with good resources going home. So what's the number to call? What is the outpatient office? Who can I contact if I have issues? And then here at Metro, we do have a lactation support group every Monday that's kind of just open. You don't have to have an appointment. You can just show up from 12 to 1.
Okay.
It's great because moms come if they're having trouble, or maybe if things are going well. It's a great community support. They can meet other moms in the same season of life as well.
And share those experiences.
Yeah.
Absolutely. Okay, so as a mom who was breastfeeding, there were times where, it's kind of challenging. Sometimes you have great days. Sometimes you're like, what just happened? Because there's nothing.
Yes.
But, you go to the stores and you see these lactating products that are supposed to help you get more milk and stuff like that. Do you, I don't know, do you think those work?
So I would say I'm a big believer in just healthy nutrition in general. Some of those sometimes maybe help a little bit, but I think it's a lot of marketing, right?
A lot of moms swear by the tea. There's a tea.
They like the tea. I will say I have tried the tea. I did like the tea, but I really like, I think oatmeal works wonders.
Okay.
And then what's in a lot of the lactation cookies is brewer's yeast. You can buy that on Amazon. You can make your own cookies for a fraction of the cost. So I encourage lots of hydration, lots of water, and kind of just back to basics. Make sure you're eating lots of fruits and vegetables, eating the rainbow. It takes a lot of energy to produce milk. You actually need more calories when you're breastfeeding than you do when you're pregnant. So I think kind of just going back to the basics of nutrition, that's very helpful. But my kind of top two, if I had to pick, I would say oatmeal, brewer's yeast, and a lot of moms like coconut water and like body armor just to help with the electrolytes and hydration as well.
So if a mom was shopping though and she did have any questions, is that something she could ask her lactation consultant? Okay.
Oh, for sure. Yeah.
Okay. So a lot of times when you think about a mom breastfeeding, you're really just thinking about the mom, right? Because she's the one that's breastfeeding. But you have the father, you have the grandparents, or just the support system. How can these other individuals help support a mom who's breastfeeding?
Yeah, that's a great question. And a lot of times I think dads can sometimes feel isolated because in those first few days and weeks, the mom is doing so much and is with the baby nonstop. So lots of helpful things that support people can do. They can help keep the mom well fed, right? Keep her water bottle filled, make meals, help with other things with the baby, give the baby a bath, change the baby's diaper, do a load of laundry. I think also just supporting and encouraging the woman and, letting her know you're doing a great job. Like, I know this is a lot of work, this is really hard, but what you're doing is awesome for your baby. And it's also good for the mom too.
Yeah, and mothers, don't not use that dad, okay?
Yes.
I think my son's father, he was like, oh yeah, you got it. Like, he's gonna want you all the time. I was like, absolutely, but we need a break. So sometimes when you want to get some sleep, utilize the father or the grandparent, your support to, if, I would breastfeed and store the milk, freeze it and stuff like that, or I would store it in the fridge for same day. Feeding, and I would be like, I'm going to take a nap. You can feed, So utilize your support system for sure, because they can definitely help, especially if you have other kids, and you want to get your rest,
Yeah, you need to take breaks, take care of yourself so that you can keep taking care of your baby.
Yeah, absolutely. Okay, so breastfeeding is something I feel like has really become like a hot topic. A lot of moms are doing it in public now. We go back to work and we have our breastfeeding pods at work. Well, most places do. I know mine did. But it's definitely a hot topic where people are wanting to warm up to it. We're encouraging more moms to do it. What is something or some things that you wish more mothers knew about breastfeeding?
Yeah, gosh, there's so many things. I think that one of the main things is that I see a lot of moms also that hesitate, like, well, I'm going to try it or see if I can do it. And I just wish more moms knew that their body was made to do that and have the confidence to do it. Most women actually, when they have a baby, have enough milk for 2 babies. Just evolutionary, that's kind of how it works. And it's a supply and demand. So the more the baby breastfeeds, that tells your body kind of how much milk to make. So the supply and demand kind of like regulates how much milk you make. I wish that moms knew that there's not only great benefit for the baby, but also for herself. There's decreased risks of breast cancer, ovarian cancer, decreased risk of heart issues, high blood pressure, metabolic syndrome, things like this. All of those things can benefit mom, as well as babies benefiting by having less ear infections, having less allergies, less eczema, less GI infections. There's just a plethora of benefits to both. And that any little bit counts, right? So, I think no matter what your journey looks like and how long it is and whether you supplement with formula, I think we're all just trying to do our best job and, to be proud of that and give yourself a little grace.
Yes, grace is a great word to have because it is such a challenging thing. And like you said, we're all learning each other, the baby and mom. So with something as new, especially new moms, you're using your body in a completely different way. So I think definitely give yourself some grace because it's a lot of work, but it is so vital, and I think it's just a great thing for the baby especially. All right, so to a mother watching right now or a mom to be, and they're like, wait a second, this is too much. Like, I'm already discouraged, I'm already overwhelmed, I haven't even latched the baby on there yet. What would you say to a mom who is overwhelmed and discouraged with her breastfeeding journey?
I would tell her, you can do this. Your body was made to do this. You can do this. If it is something that is important to you, find your support system. There are lots of resources, inpatient and outpatient. Talk to your provider, talk to your midwife, talk to your OBGYN, talk to your friends, find a community, and you can do this and make this happen. And, give yourself props. It is a lot of work. Breastfeeding is basically like an additional full-time job. And, just give yourself grace, and you're doing such a great thing. So keep up the good work.
Yeah, I want to expand on what you said just about like friends and stuff. I think a lot of times we feel so alone in our journeys because it's like it's you and the baby, or it's you and your support system and the baby in this process. But it's like at the end of the day, there's so many people sharing your story. There's so many women breastfeeding and maybe discouraged and overwhelmed. And so that's why social media and getting into those chats and those groups is so important too, because you have people out there. You're not alone. So you can share your experiences, get that support, get those your hype men or women to just cheer you on and keep going, because it is something. I know for myself, I said I'm going to breastfeed. My son's name is Kingston. I was like, I'm going to breastfeed him till he's 1. I challenged myself to at least do that, and I made it past that because I also froze milk, so he had breast milk till he was 2. But challenge yourself and get the support to meet that challenge, because it is important, and it's so we literally have like every new what did I say? The nutrients is the
it's
best
everything
thing.
the baby needs for the first year of life. Yes, you make that.
You get to save some money. You know how much money you save?
Yes.
Formula is expensive. Not saying that formula can't be had or given to your child, because we understand that sometimes it goes that route too, but save some money. Breastfeed.
That's right.
You know?
That's right. Yeah, find your village. We weren't meant to do this alone.
Absolutely.
So, that's what's the benefit of social media. And the only other thing I would say is don't fall into the comparison thing with social media, because so many women post all these freezers full of milk, and you do not need that. You do not. You don't need a freezer full of milk, and so don't try to think about what everybody else is doing, let's build each other up and focus on what's working for you and your baby.
Yeah, because everybody's story is special to your own, but the support is there if you need it. If you have a question, you're like, is any other mom experiencing this? Then of course utilize that group. But I love that point, because a lot of times we see stuff and it's like, oh, they got the picture perfect situation. You don't really ever know what's going on behind closed doors with that family or that mom. One, two, it's not yours. And I think that's what's so unique to us. Like, embrace your experience, embrace your journey, and just, take it every day at a time and give yourself grace. So, Abby, I want to thank you so much for your knowledge and sharing, because that's what Mommy Virtue is about. It's a village. It's our support group for you out there. If you are a mother or an aspiring mother, to come together and get all these good resources and all this good information to just help you stay, committed to your mothering journey from here on out. So if you are struggling with breastfeeding, or you're just looking for some more postpartum support, MetroHealth is definitely here to help, okay? So please schedule an appointment today by calling 216-957-1500 for the Broadway Health Center, or 216-778-2222 for the main campus pediatric clinic. And for more detailed information on all the pregnancy resources right here at MetroHealth, you can visit metrohealth.org/OBGYN. So thank you so much again.
Thank you.
Till next time.